The amount of data required to make consistently accurate medical diagnoses is mind-boggling. As a result, many healthcare organizations are implementing artificial intelligence to improve decision-making and streamline nearly every aspect of running a practice. Welcome to AI Universe, and today we're going to take a look at the progress of AI and how patients benefit from artificial intelligence in healthcare. Make sure to subscribe to the channel and do not forget to press the bell icon to get notified every time we unveil a mystery. Healthcare and artificial intelligence has come a long way. Computer technology has advanced significantly in recent years. Today, sophisticated machines have been developed to assist humans in performing human tasks such as data analysis and interpretation, as well as problem solving. While machine learning has been widely used in many industries, the use and application of AI in healthcare is still in its early stages. AI has only recently made the transition from academia and research laboratories to hospitals. AI is used to evaluate risks, make accurate diagnoses, and carry out precise surgical procedures. AI is now used in a wide range of medical specialties and services, such as rural care, surgery prioritization, drug discovery, and survival analysis. Artificial intelligence has excelled at analyzing big data collected by healthcare organizations. AI enables quick data analysis. Data enables proactive risk assessment, closes public health gaps, and explains how behavior, genetics, and environmental factors affect population health. AI provides a holistic approach to patient treatment protocols by combining this information with diagnostic data. Predicting at-risk populations based on genetic, behavioral, and social factors is one of the most significant benefits of AI in population studies. The potential of AI in public health is enormous, and healthcare institutions are now utilizing it to provide more personalized, data-driven care to patients and help improve outcomes. The differential diagnosis of any disorder is enormous in medicine. To obtain a definitive diagnosis, a differential diagnosis requires time, labor, and money. AI has greatly simplified this process. Machine learning algorithms can reach a definitive diagnosis faster and with greater accuracy than conventional pathways. As a result, the use of artificial intelligence in clinical diagnosis has reduced diagnostic errors and allowed for faster treatment of serious medical disorders. AI-enabled tools can sift through massive amounts of patient clinical data, which can aid in making an accurate diagnosis and initiating early treatment. Another area in which AI has excelled in robotic surgery, robots that can now perform delicate surgery have been developed as a result of advances in electronic technology. The surgeon still has control over the robot, but it can perform micro-dissections and enter delicate spaces that the human hand cannot. Robots have precise movements in their arms and can perform complex operations on the brain and heart with pinpoint accuracy. This has been demonstrated to reduce the risk of blood loss and complications. Additionally, all data from robotic surgeries can be saved, which can aid in surgeon learning and training. AI-powered chatbots are possibly the most widely used AI technology in the healthcare industry right now, because they are simple to implement, improve the patient experience, and assist medical professionals in interacting with and treating patients without the massive time investment that traditional customer service methods require. Natural language processing, sentiment analysis, machine learning, deep learning, and concept extraction algorithms are used in this AI application to provide instant answers to patients' statements or questions about topics such as paying bills, appointment scheduling, and medication refills. An AI-powered chatbot identifies your patient's needs with a quick chat by asking questions about their symptoms and problems. Based on the responses, it then assesses and understands their issues and directs them to the next steps. Chatbots help to improve the patient experience because they are user-friendly, interactive, and available 24 hours a day, 7 days a week. After all, we've all been awake at 2 a.m. wondering whether or not that thing on our leg was serious. Furthermore, patients are more likely to feel at ease speaking to a chatbot rather than a person about sensitive issues. When you see them in person, they may reveal more details, which aids in providing a more accurate diagnosis. If the problem is severe, chatbots can guide patients all the way to your practice by assisting them with appointment scheduling. Overall, improving the patient experience leads to increased patient retention and referrals, which helps your healthcare organization thrive. It also saves time, which is always in short supply in practice setting. A virtual assistant is an artificial intelligence system designed to engage patients. It employs augmented reality, cognitive computing, machine learning, deep learning, and speech recognition to provide patients with a personalized experience in which they can ask questions and learn how to better manage their health. A virtual assistant, as opposed to an AI-powered chatbot, is intended to assist patients throughout their treatment by providing consistent support rather than one-time interactions. Virtual assistants can also help administrative staff by streamlining clinical workflows in a medical practice. They facilitate the exchange of patients' health history, insurance, and demographic information between departments, ensuring that everyone is on the same page and nothing gets lost in the shuffle. People who live in rural areas frequently struggle to find specialists. People who have to travel to large cities to avoid long waits. This is not only inconvenient, but it can also be costly for patients. Primary care physicians can use AI to evaluate patients with all types of medical disorders, whether they live in the city or in the country. AI robots, for example, can screen for eye diseases and send images to a specialist who can recommend a treatment. This is enormously beneficial for patients as the diagnosis is made rapidly and their treatment can start immediately. The use of artificial intelligence in rural areas has enabled primary care physicians to effectively triage patients who require urgent treatment from those who can be managed effectively. Overall, developing an AI digital infrastructure in rural areas can provide people with access to cutting-edge medical diagnoses and faster delivery of care. Artificial intelligence in healthcare can help to alleviate the shortage of specialists. Primary care physicians are plentiful, but specialists are frequently unavailable outside of major cities and towns. AI has aided in diagnosis in low-resource areas by interpreting imaging studies such as chest X-rays, CT scans, PET scans, and MRIs. A primary care physician does not have to wait days or weeks for a radiologist's reading. AI can accurately interpret these images on the fly. This means no more waiting for a diagnosis for patients, and it saves a significant amount of time traveling back and forth to a radiologist. Healthcare facilities are complex entities with thousands of patients, massive amounts of patient data, and numerous interconnected processes and systems. This can often undermine efficiency, lead to long wait times for patients, and in some cases, even lead to delays or missed appointments. Furthermore, by optimizing workflows, AI can prioritize services based on available resources and improve revenue cycle performance. AI has enormous potential in healthcare, both inside and outside of healthcare institutions. Hospitals are constantly challenged financially. As AI becomes more prevalent at all levels of healthcare, large amounts of healthcare data can be extracted and correctly analyzed. The data read by AI can provide more information about the causes of complex disorders. Clinicians can rely on AI to identify conditions and benefit from guidance to develop effective treatment plans. The application of automated machine learning, in particular, contributes significantly to the automation of the data analysis process. AML employs automatic algorithm selection, visualization of results, and improved interpretation. There are several machine learning processes and algorithms that can be used to make healthcare data more useful in order to improve clinician decision-making. As a result, diagnosis and treatment can be improved, as well as patient survival and mortality. Still watching? We knew you'd love our video. Well, we'd be even happier if you could just hit that like button. Coming back to the scenario. What do we think about the role of AI in healthcare? Fortunately for you, large healthcare organizations have been using artificial intelligence for years. As a result, it has evolved by learning from the medical data of hundreds of thousands of patients worldwide. As a small practice, you can reap the benefits of these large healthcare organizations because not only is technology improving, but patients are becoming more accustomed to it. They may even come to expect it in the future. And with that being said, it's time to end our video. But before that, we'd like to have your opinion about the healthcare sector. Are you impressed with how far AI has evolved? Let us know in the comments, and make sure to subscribe to the channel for more amazing videos like this. And now that we know you love our videos, make sure to watch these as well. We'll see you in the next video.